Thank you. I want to thank you, Mr. Chairman, for holding this hearing, and thank our witnesses for being here this morning. As a representative from the state of Illinois, I'm very interested in this topic because my state experienced some of the same meth abuse problems as Chairman Bouchon's district and state. Geographically, Illinois sits right in the center of the top 5 states in the country for a number of clandestine meth lab incidents reported in 2012. With 801, it had the 5th highest number of lab incidents. My colleagues in districts affected by heavy meth abuse, as well as my colleagues in districts affected by other illegal drugs, understand the heavy burden placed not only on families, but also the local economy, hospitals, law enforcement, and the court system. Unfortunately, if the sequester continues, Illinois will lose about $3.5 million in grants to help prevent and treat substance abuse, resulting in around 3,900 fewer admissions to substance abuse programs. Congress and individual states have developed laws aimed at making the precursor chemicals for methamphetamine harder to purchase, as the Chairman stated, but there's still more work to be done. In order to do our jobs and craft effective policy to combat meth addiction, we need to know more about the science behind addiction and effective prevention and treatment programs. Much of the research we will hear about this morning is funded by the National Institute on Drug Abuse at the National Institutes of Health, which unfortunately is not in our committee's jurisdiction. I hope today we also have an opportunity to explore the types of foundational social and behavioral research, as well as the neuroscience research, that underlines much of the more application-driven research that is the purview of several of our witnesses today. As Dr. Gene Robinson testified at the Brain Initiative hearing in July, it is necessary to understand how healthy brains work from both a functional and behavioral perspective in order to cure the many devastating brain disorders that afflict our society. This is the type of science championed by NSF. Because of the important work already supported by both NSF and NIDA, our society is starting to accept addiction as a disease of the brain influenced by environmental factors. Many people addicted to drugs trace their problems back to their school years and acting out teenage curiosity. Thus, to meaningfully change this trend, our conversation must also include teen behavior and drug use, and how we might use the education system and public education campaigns as vehicles for prevention. Unless we apply what we know about teenagers' brain and behavior to the design of such education efforts, and change course as we learn more, we may be setting ourselves up to fail. I look forward to Dr. Napier's testimony on her work studying the adolescent brain in supporting school-based curricula to help kids build good decision-making skills. These are the very skills they need to keep themselves out of a penal system where they are often introduced to a network of drug dealers within their communities, making the likelihood of relapse after release from jail very high. Social networks and markets for meth are also important topics of research that can inform the development of more effective prevention policies. For example, we know that meth abuse often circulates within families among close acquaintances. Additionally, as I understand it, whereas meth labs used to be typically in a room or basement of a home, a 2-liter shake-and-bake bottle can now be quickly improvised in the back seat of a car or behind the dumpster in a schoolyard. We also know that meth is more successful in penetrating some markets than others. Identifying and understanding the factors behind the meth market and how meth abuse spreads in social networks is a challenge that requires collaboration among social scientists and law enforcement officials. Finally, evidence-based policymaking is essential for effective treatment. If meth addicts are only fixated on their next high, as research has shown, then the standard 12-step program will not be an effective treatment tool for them. Treatment programs for meth addiction have evolved based on our increased understanding of what works and what doesn't, but more progress is still needed. As a social scientist myself, I find all of these to be interesting, compelling research challenges. Before I close, I'd like to mention that a bipartisan law was passed through our committee in 2007 that addressed meth, specifically with a focus on a lack of national standards for remediation of meth labs. For every pound of meth produced, 5 to 6 pounds of toxic byproducts remain in walls and carpets, as well as ventilation and wastewater systems. Perhaps it's worth the subcommittee, though it's this jurisdiction over NIST, reviewing where we now stand with respect to remediation standards. I think this is an area in which we can work again on a bipartisan basis for the health of our first responders who investigate meth labs and citizens in those communities. Again, I look forward to hearing testimony from witnesses, and I hope the testimony can get us thinking about how research can help us better tackle the increasing meth addiction problem plaguing our communities. Yield back the balance of my time.